Welcome, everyone. We are so excited to have Dr. Jenny Jessen with us today. She is going to be talking to us about one team, one goal, and really exploring how we can be good mentors across all of the different health professions. Jenny is the executive director for CYPER, which is our Center for Interprofessional Practice and Education and Research. And I feel like Jenny has really become a good friend. But even more than that, in the last couple of years that I've known her, I feel like Dr. Jessen really walks the talk that she is going to be talking about today as she reaches out across different programs, different health sciences, different specialties, and she really encourages that interprofessional education and collaboration, which we really do encourage here at Creighton. There is going to be CE credit, and towards the end of the session, I will share that in the chat with you. And please put questions in the chat. I will be monitoring that for Dr. Jessen, and I will turn the time over to her.
Thank you so much, Jessica. You are a good friend. I think you are a good friend. And I'm sorry, I got a little misty during that. That was really a wonderful compliment and incredibly meaningful. So thank you so much. I am excited to talk to you about a topic I really love talking about. Hopefully I can get you to feel the same way about it and see its advantages. So what we plan to go over today, mouse over here, excellent. What I want to talk to you about is the benefits of mentoring students, maybe that aren't in your profession, across professions, just maybe the benefits of mentoring students and talking to them about team practice and teamwork. You'll learn a little bit about interprofessional education requirements, so you have some working knowledge and why there's a focus on this. We'll talk about where you can develop students and maybe different strategies you can use to develop students. And some best practices for mentoring going forward. So all about that collaboration today. And like Jessica said, my name is Jenny Jessen. I am a nurse. I'm a graduate of the Creighton Nursing Program, traditional class in Omaha '04. I worked primarily in perioperative nursing, so pre-op, PACU, and intra-op. And I think that really had an impact on my work in education and interprofessional education, because if you're familiar with an operating room, it is a tiny little team in a very concentrated area for a concentrated amount of time. And if you have a team that works really well in the OR, the surgery goes great. And if you have a team that doesn't work so great together, it can be a disaster, and that has impact on our patients. So that applies in lots of different areas, and it makes it easy for me to see the application to lots of different areas in healthcare. My master's is in nursing education, doctorate is in health professions education. I have been at Creighton for 7 years now, and I teach half-time in the nursing program here on the Omaha campus, and the other half of my time is really invested in our center. So that center, let me tell you a little bit about it. If you're not familiar, CYPER, Center for Interprofessional Practice Education and Research, is an entity that does not exist inside any of our health professions. And that's a good thing and a troubling thing sometimes. We're not part of nursing. We're not part of medicine. We're not part of SPAP. We are a standalone place that helps all the different health professions meet accreditation requirements around activities. And that's what we do most of the time, helping different programs coordinate the learning activities so students can be working together. But we do lots of other things. We support clinical sites that are interested in being more interprofessional. We teach a lot about teams and team skills, psychological safety, negotiating conflict, and we do research and support students and faculty research. So if you are interested in working on interprofessional based projects, you want data, we have so much data, especially from students who are participating, we would be a great partner with you. All right. So why is it that I'm always hearing about teams? Because if maybe I'm hypersensitive to it, but in any educational ad, healthcare ad, a lot of times they boast how interprofessional they are, how collaborative they are, how much they have people working in teams. And it's not even just in healthcare. It's truly that you are seeing more teams. The studies that we have and the research that looks into it, they say organizations are pushing teamwork. They're looking at it as a way to increase their efficiencies and impact outcomes for their groups, if that's a business organization or if it's a healthcare organization. So if it feels like you're working in group projects more, you are. That is absolutely what is happening. It is trending in that direction. So teams are here to stay. For my students who I have in class, I like to ask them, like, who likes working in group projects? And none of them will raise their hand. I'm like, well, tough. Life is one big group project. You are going to be expected to do this forever. Now let's talk about it inside of healthcare. Healthcare teams are absolutely essential. And a lot of the interprofessional leadership that we have and principles and education requirements really stemmed out of healthcare itself, because healthcare is a team sport. It is one that involves multiple professions working together because, as it turns out, one practitioner can't be expected to know every single piece of what is going on. So healthcare teams are linked to improving patient outcomes themselves and how patients do with their health, looking at reducing costs. So there's a financial incentive that is really important to healthcare organizations. Improving your experience. So if you're a healthcare provider and you work in a team that you feel supported on and that you feel you can rely on, odds are you're going to enjoy your job more and maybe want to stay in that job longer, which is really important. And then addressing health equity. There is a special place for teams within policy and advocating and looking at different ways that we can reach patients, because especially when we look at different conflicting things like social determinants of health and other factors, it can be really impactful to have teams come together to help work on those. All right, and we have data. We have a lot of data. It comes mostly from a safety and quality perspective, and it's about 20 years old. So 2 decades worth of data that says if you have good teamwork processes, you're going to have better outcomes and patients will be impacted, especially around errors and looking at reduction of errors and reduction of things that affect patient morbidity, mortality. So you're going to have patients who do better, less people dying, more money saved, and look at overall better performance in your teams. So that's fantastic. And when leaders see this kind of data, they're like, absolutely, I'm on board with teams. How can we get teams improving these efficiencies in our organization and maximizing our revenue? The hard part is getting teams to perform well. It's not enough to put a team together. It's not enough to say, all right, all of you, I'm going to drop you into this room. I'm going to have you act as a team. There's an actual skill to it. If you interview students individually, which we do every year, they think they're fantastic at working in teams. And through their education towards the end, they actually rate themselves lower at the end of the program because it turns out that they don't know what they don't know. And they're like, this is actually a lot harder than we thought. Maybe I'm not as good at this. If you look at the literature, I love this stat that 92% of people view teams as important to their work, absolutely critical to their work, but only about 25% think that their team is effective. So there's a lot of dissatisfaction with people who work in teams currently. So it's something that needs to be addressed and worked on. Another quote I love, and this has a lot to do with being on a team, that if you have good experiences, good collaboration, people who feel positively about the team, that will be amplified. And they will state how important teams are and that this team is the best team. But if you have some that are negative, that will actually grow and exaggerate people's viewpoint of teams and the work that they do. So that value and attitude towards teams and the work that you do is very paramount. So think about that. Healthcare education has adjusted to work on this. In fact, there are 24 different accrediting bodies, I think it's more now, that have all come together and said, listen, teamwork is so important in my role as a nurse, a pharmacist, a dentist, that we're going to write it into the accreditation requirements that students have to learn this while they're in school. It's important that they start while they're in education, so they see value in their collaborators, the other people that they work with in healthcare. The World Health Organization is the most commonly used definition of interprofessional work. It's when students from 2 or more professions learn about, from, and with each other. And that can be kind of broad, and how people interpret that a little differently. But it's that about, from, and with that we really love. So you have to learn about the roles of other people. You have to learn from them, not me as a nurse teaching what physicians do. It should be physicians teaching nurses what they do. And then you have to learn together. So what things can we learn collaboratively together? From that, the core competencies were born. So if you're familiar with accreditation work, you probably know about IPEC and their core competencies. They wrote out specifics of what should be the expected demonstratable skills of someone who's a good collaborator and a good team player. There are 4 main categories. One is on values and ethics, saying, I value working on a team. I value team members. I value the input of others. And I have been in groups where people are like, I do not value the input of others. I will only listen to this specific set of professionals. So it's that understanding from the start that I am in this with other people. I cannot be expected to know everything, and there are others with expertise that I can benefit from. So starting with that. Roles and responsibilities. Roles and responsibilities is actually one of the primary simple things that is a very cognitive piece, is learning about other professions. Now, I graduated at a time where interprofessional education was not a big piece and not a huge impact. And so my generation and generations that are older haven't really grown up understanding the roles of other professions, maybe as much as we should. I think I was in practice like 2 years before I learned that PT and OT were different. And that's not uncommon. So sometimes faculty, especially or clinicians that have been in practice for a while, almost don't want to admit that they don't know something about another profession, but it is absolutely fine. And it's role modeling that humility to other students, saying, you know what, I'm not quite sure. I'm going to learn more about them. I think it was COVID that actually highlighted how much pharmacists can do med administration for me. And I've been working in nursing education for a long time. So we all have a ton to learn, and more can be done in this area for sure. Now, the one you're probably most concrete about is communication. And students will tell me over and over again, I want to learn how to communicate with others. And that is fantastic, because a lot rides on an interprofessional communication. If things are communicated accurately, concisely, and done in a way that is respectful, there's psychological safety on your team in a way that you feel you can speak up and you can advocate for your role. And we do a lot, especially in simulation and different case scenarios, that looks at the value of communication and how students can practice that. And then the final one is teams and teamwork. And those are the art of working in a team or a group project. If you want to keep it simple in your head, like who's going to turn this in? How will we negotiate when we don't all agree? Is conflict good or bad for our team? What are the expected deliverables from each member of the team? How do you negotiate that? How do you defer? Is resolving issues within a team. So those are those 4 skills. You can look them up online, and there's a huge list of subcompetencies, and like true academics, we revise them all the time. And there was a new set that came out recently, so it's interesting. So back to CYPER. This is really our role, is to help students work towards these different interprofessional competencies and these skills and build them up and design things with faculty in a way that gives them an opportunity to authentically participate in those things. And we do a lot. So if you're not familiar with what students are required to do, this is required for graduation. I'm going to try to stop the animation. There are 9 different health professions inside of Creighton University that participate in the interprofessional education that CYPER puts out. So PT, OT, pharmacy, nursing, graduate nursing, paramedicine, medicine, PA, dental, and public health. I think I got them all. So all of that's a huge amount of students that we have to pull expertise from. We're really blessed with that. There are some institutions that have two professions and they're trying to get their students to work together. We have this plethora of competent viewpoints and diversity that is fantastic, but it doesn't just have to be those professions. We are open to working with dental hygienists, radiology techs, rep techs, even business and law, and we do interprofessional things outside of just health professions, because it turns out patients have other things that contribute to their health that isn't just around anatomy and physiology and medication. All students are required to do 3 interprofessional activities before they graduate. The different programs have different levels of involvement in that, so they might be very prescriptive and say it must be these 3 activities, or you can pick from this menu that we provide. It's their prerogative to help prescribe what they want students engaging in. But students are always encouraged to do more and find topics that are really they're passionate about, because we have so many different things. All of this happens online and in person in lots of different types. I mean, we have over 100 approved activities at this point right now, and we're always refining them and finding better and better experiences for our students. Some of it's case studies where they're working in small groups and teams and they work through a patient. Wow, something authentic, something that was developed in practice. We have topics from anything you can think of. We have LGBTQ case scenarios and what it's like from that perspective to be a patient. We have implicit bias scenarios where you're faced with racism in the workplace and how do you respond in the moment. We'd have different chart reviews, and we do different experiential levels. So you might see things like telehealth or rounding in the clinic, to simulations like a code. Right now on the Phoenix campus, there is a stroke simulation day where students from all the different health professions represented on that campus work through from symptoms all the way to post-care. And they talk about how the different professions work with that patient along the way. We also have clinical and engagement areas. St. Vincent de Paul Clinic in Phoenix is fantastic. Dr. Tina Younger is incredibly interprofessional, and she's a wonderful representative of interprofessional practice. First Place is another great agency that we've partnered with, so students have the opportunity to work alongside another profession while they're learning about care. Now that's all really good, but it's not easy, right? What makes it challenging? Well, logistics. Logistics at the top, because none of your programs are on the same schedule. You all have different requirements. Honestly, we all have different definitions for a lot of things, what makes it really challenging. And you have different understanding of interprofessional education too. I worked with a nurse once where I was trying to set up a shadowing opportunity where they spent 4 hours with a different profession while they were in an interprofessional clinic. And she said to me, but they won't be learning about how to be a nurse. And I'm like, well, they spend 4 years doing that. So I think 4 hours learning about the role of someone else is going to enhance their understanding of their role and make them prepared for their role. So trying to get faculty buy-in and clinician buy-in is saying this is important, because if I don't have good collaboration with the other people that I work with day in and day out, I'm going to be miserable and my patient is going to suffer. So we do a lot with faculty as well. Resources, we don't have a ton. Like I said, we're not part of a program, so we're just a small center and we set different areas up to be successful. But we work really hard. We have program managers on staff who will go every length to help you organize your event, register students, do the tracking, do the assessment, compile the data for you, find partners, connect you to the right people, support your research, all of those things, because I know especially time can be really challenging. So we work hard on that end to make sure that we're supporting at every possible point we can. So it's an easy way for students to participate. Sometimes what's hard is finding an organization whose culture matches what we really want students to have an opportunity in. When we do alumni surveys, sometimes the students say, you did a great job telling me this is important. You hammered into me that I need to be interprofessional when I graduate. And then I worked at an agency where no one thought it was important. And I didn't see a lot of it, and people were really siloed. So that can be really challenging. So we look for opportunities where there's excellence, and we show how important it is and how well it's working. And we showcase that to students because we're like, look how it can be though. Like, look what people get out of it. So how can we grow collaborative skills in practice? So I'm going to talk to you a little bit about interprofessional identity. And I'm sure you've heard a lot about professional identity. I look at TikTok. Shamelessly, I like TikTok. And there is a doctor on TikTok, Dr. Glockenmufflecken, something like that. He's an optometrist, and he does funny videos from the perspective of physicians in lots of different disciplines, right? The orthopedic doctor, surgeon, fighting with the general surgeon, fighting with the nephrologist, and the whole scatterbrained family practice doctor. And I love it because he does it in a humorous way that brings out some stereotypes, but it demonstrates the differences and the collaboration necessary and respect and humility you should have for people in aligned professions with you. When you look at professional identity and how it's formed in students, media has a huge influence on how they view what their profession should be. Like, for instance, in nursing, how many of my students come to me with this idea of Grey's Anatomy, that they're, working in that mindset, and it socializes them to the role. What is expected of a nurse? Well, they work a ton of hours, they're working in ERs, they're working in these areas. So a lot of that is formed by socialization. And then more will happen when they start in their programs. They'll learn more in depth about the role. And professional identity is great, and it has been studied in the literature on and on. Interprofessional identity is your identity as, where do I fit on a team then? Like, how do I compare to the other people that I work alongside with? And it is less developed and not studied much at all until now, looking at how we build that skill, because the small amount of research shows that if you start at this early, and if you do professional identity alongside interprofessional identity, students move forward with this idea that it's not all about my profession, it's also about how I fit with the broader team. And there's different ways to develop that. So we're going to go through these a little bit. Professional identity, how you impact alongside with interprofessional identity. And it starts right out with career selection, why they choose to do what they choose to do, early experiences, early clinical training. When we get to interprofessional education experiences, we'd love for them to be early alongside when they're forming their roles. Sometimes I get pushback from faculty, and they're like, we need to teach them about our profession first, and then we'll get to interprofessional education later. And research has shown that starting early and doing it alongside is actually more beneficial, that they'll get both if you can do it at the same time. The goal would then be getting to common goals, valuing collaboration, and equal status. So professional training, what are some things you can do? Like, okay, I'm interested, I want to develop interprofessional identity. What can I do? Start by just socializing students to your role on an interprofessional team. So if I have a nursing student with me that day and I'm bringing them along, I'm going to talk to them about, all right, my job is to document this. I'm going to make sure I document in a way that it's readable to this group and on a timely manner, because I know that they're going to want this information later, because I'm trying to be accountable to the rest of the team so they have what they need to do to make a decision. Or grand rounds, or rounding, interprofessional rounding. I'm going to be going on interprofessional rounds later. They're going to expect me to bring this information. I have to time manage myself in this way so I'm accountable to the team. An easy one is to introduce students to other people that you're working with. So I have a nursing student with me. I'll be like, this is the respiratory therapist. They're fantastic. They're here all the time. Their expertise is in doing this, and they're available to me for these reasons. And just so there's some socialization of other people, not just in your own profession. And then talking about what collaboration does and why it's meaningful and why you can't do it all by yourself. Another thing you can do is discuss the scope of others' roles. Do not assume students understand the differences between the professions or what their primary role is on the team. They won't tell you that though. They won't tell you they don't know something because they're infinitely scared of not being prepared or not knowing something. So pretend that this is all new information and really needed. And it's okay to talk about it in a limited manner, or if you don't know, it's okay to ask. It's absolutely okay to ask. There's going to be different communication styles. I'm going to point out nursing and physicians because that's what I have the most experience with. Nurses are trained to be very broad and narrative. And I'm going to tell you about the family members and what they came in smelling like and who was there that day and, you know, how they felt about their meal. And physicians are not, they're very focused on specialty. They're very directed in differential diagnosis, and they're not as all as encompassing. That's fine. I'm not saying one is better than the other. I'm saying if you understand there's a difference, it's easier to communicate so you can meet each other's expectations. Talk about how others are educated. And this is hard. I'm still learning a lot about this. So if you're working with a physical therapist in the room, they're like, tell me, how much time do you spend with patients? How many years are you in school? And just be curious and learn about other professions. And it goes a long way for students to understand the level of work they can do with others. Authentic, positive experiences. Students don't like it when you give them things that they don't feel are related to real life. And they notice. And I collect so much evaluation data that they'll tell me, they're like, stop giving us easy stuff. We want the complicated and the messy, and we want things that are actually going to happen. And that is absolutely fantastic. Sometimes I'd really like to show them a way it's supposed to go before I show them the messy, but feel open to bringing them along and pointing out things that don't go well and saying, this is how it should look. This is how it would be better reflected. We do a lot to focus in on communication and delivering bad news, talking about things that you're not comfortable about, doing education and how you can share that with other team members. Watching is great. Even observation of another person doing an excellent job, watching a lactation specialist and do education for a family member is beneficial, even if you're a pharmacist, because you have an understanding of what goes into that role. And then think of other maybe unique ways that you could bring students along with you. Is it a health clinic? Is it a vaccine clinic? Are you doing telehealth? Are you doing like EICU work, interprofessional rounding, grand rounds, M&Ms? There's lots of ways that we work together. We can't be scared to show students what that looks like and how it's done. And we're trying a lot of really fun things. It's a fun area to work in if you are ever interested in participating or working alongside CYPR. We get to do really cool stuff. One is we have a code simulation. I think Lindsay Iverson was on. Yep. She's leading it, and it's a medical emergency. So the students don't know it's supposed to be a code, but it's going to be a code. And we don't do it in a traditional hospital room. Might do it in a waiting room, might do it in a dental clinic, might do it in a dental chair, and having different people participate. One of my favorite stories from that is the paramedicine students. The EMTs are like, oh, we got this. And they're just all the way in it. And then a student of a different level who maybe it's a medicine student that felt that they should be responsible in leading the code, struggling. And like, how do you share responsibility and communication during that, and different levels of expertise and different levels of learning. One that's being built now that I'm really excited for is a medical malpractice lawsuit. So there's lots of different opportunities from real life that we can provide with this, but having law students and health profession students work together to talk about what is good documentation. Having it in a courtroom setting would be our ideal, maybe doing depositions, and really doing something messy that students would love. And I'm also building an international experience right now in Togo. It's West Africa. I can't think of a better way to learn team skills than when you are dropped in an environment where you do not have any resources and maybe you don't speak the language and you're working with a community of people you're not terribly familiar with. In times like that, you absolutely rely on each other. You get to know each other, you get to know what each other is capable of doing, and you rely on each other's expertise. So look for a different communication on that because I'd love to share it. Post-licensure is another area we talk about a lot. So what can be done after students leave school inside those clinician areas? How can you make sure that you have interprofessional collaboration and it stays important outside of school? We push continuing education on interprofessional skills. And I'm working with a group right now that's looking at some rural health clinics and doing team training, team exercises and scenarios, because it should be something that you're continually building your own skill on and having conversations about and the importance of teams. Where we've integrated good interprofessional collaboration, if we don't give it attention, we see that some of those practices back away and then it kind of comes apart. So it does take intention and effort and skill building. Seek out cross-professional mentoring opportunities. I would love for all of you who work in practice that if someone says, would you like to take a student today? And it's not a student from your profession, you're like, absolutely, I can learn a lot from this. You don't have to feel like the expert in that person's profession to be a valuable contributor to how they view your profession. You can learn something. You can build up that student by asking them about their role and their expertise and their knowledge about something, and show humility and show curiosity with how you practice. And what that does is it leaves such a good impression of you working with that student. Like I worked with a PT the other day and they were fantastic. I mean, I watched them perform things that I'm not going to be able to replicate myself, but I learned a lot about what their function is, and they were wonderful to me. They were curious about me. They demonstrated this respect for what I do. And that goes a long way. It stays with them for a long time. And what it will take though is some advocacy, because it is not traditional. It is not what we're used to doing. So we found a lot of pushback in that. But push back yourself. Like there's absolutely no reason that student couldn't follow me on what I'm doing today, and they can benefit and learn from this. So if I get you all involved in that, it will help me so much. Now, we do have to discuss the role that power and hierarchy in healthcare applies to interprofessional teams. The traditional model is one where a physician is at the top of the team, maybe like administration above that physician, and then the rest of the professions fall. And there is that hierarchy that exists. And we are working to flatten the hierarchy so that people feel like they're equal contributors to patient care. But there's factors that complicate that. And a lot of it is tied up in reimbursement. We have models where a physician's referral is necessary for insurance payments, and that's just the way we live. We have a model where physicians are not reimbursed for time they spend in collaborative care meetings, but more on individual patient care and pumping out patient visits. So working to find ways, creative ways, or advocate for ways in which that is changed will be difficult, but necessary for there to be effectiveness in leveling the playing field for the other professions. It's not inherently a problem that physicians are leading and have the most authority on teams in most situations, because if physicians can role model excellent behaviors in collaborative care and the professions that they work with feel that they have a voice and expertise is used on both, then it can be absolutely successful. But it does take typically a physician role modeling that and leading that charge when they're working on teams. And demonstrating to leadership, demanding in leadership. I'm going to have a nurse leader on my role with me. She's just as important, or he's just as important in working alongside of me. I need a behavioral specialist on this team, and I won't work without one because they contribute so much to the care of my patient. There has been studies on the role physicians play, especially in power and hierarchy. If you survey them and you say, are you a good collaborator? Most of them will say excellent collaboration, and then the other professions will rate them lower at collaboration, much like our students think they are. But some examples of what that looks like might be physicians dominating conversations. And I've had this in interprofessional education activities occasionally too, where it might be, for instance, a stroke simulation. I'm not using that one. Let's say it was a stroke simulation. It can be, it turns out at the end in the debriefing, all the physicians went first, rather than talking to the occupational therapist or the pharmacist and asking for their input. So we have to be careful to role make that at all stages. Lack of respect felt when it came to the professional's time. So, you know, could you do this for me? Or not making an attempt to look things up and be prepared when you talk to another profession. And this goes both ways. I work a lot with nurses and physicians. You know, the nurse doesn't want to be asked, can you go find those vitals for me, when it's something that you literally have available to you on a piece of paper. But alternatively, the physician wants pertinent information provided at the time of the phone call as well. So that respect goes both ways. Inclusive language, calling it our team, referring to us as a team and not my team, my people, or saying, you know, everyone else can be on a first name basis, but I can't, is a lot of ways that people have discussed that. Failure to defer to another professional's expertise, not relying on the pharmacist to give you the best advice when it comes to something, or referring to the dentist for this very specific piece of care. And failure to consider the other's perspectives. And like I said, when you do have that legal liability tied maybe to the way that you deliver care. So if a physician carries the liability, they're seen as the ultimate decision maker on that team. And I do understand that. And the team actually understands that too. What they're looking for is, how was my viewpoint considered? How was my expertise brought into the conversation? Was I consulted as a member of this team? So when we say collaborative teams, really the goal is to share power on the basis of knowledge and experience rather than roles. And a lot of times you might hear a term called clinical democracy, where it's power that's not distributed on the basis of what we're used to in those typical hierarchies, but really what's relevant in this specific situation for this person. So how should responsibility been shared? Like I said, I honestly feel physicians are put in a difficult position, because on one end of the spectrum, they're being asked to share power, but they're in this privileged role, right? They're being told by leadership, that's not how it's going to work. They're told by legal systems, that's not how it's going to work. And we still have to operate in this large organizational structure that has been around in healthcare for a long time in that leadership role. Just as similar things like physicians referral for fee-for-service kind of models. And that can be difficult. It's not that physician leadership is problematic. Like I said, it's not that they're doing a poor job. It's that looking at what is the dialogue between the different professions. And then more broadly, you know, how is that communicated to the public who doesn't work in healthcare and understand the intricacies of working on a collaborative healthcare team? All right, so I'm going to leave you with a few final thoughts from my years of working in interprofessional education with different groups and personalities and viewpoints and students. Here's what I need you to know first. You are the absolute difference in how a student views their profession and the professions of others and the roles of others. It is their mentors, the clinicians they work with and the faculty work with, that have the largest impact on whether they will value interprofessional teams or not. It will have a lot to do with how you speak about other professions, how you speak about other faculty, how you speak about other students. It will rely on how often you show the importance of respect to other professions in a clinical setting. how you document, how you communicate, how you operate and role model being collaborative. So you have a big piece in this. It isn't just saying it's important, but it is also kind of living that and embodying that in when you care for people. And I know you're probably thinking, oh, she's calling me out, I'm not doing a good job. But a lot of times you might not think you're an expert in collaborative care when you probably are. If you've been working in healthcare for any length of time, you've had to intersect with a lot of different roles. You have to be able to say to students, I don't know everything about that, and that's okay. I don't know everything about what they're going to prescribe for this patient or how that medication is made. So let's go ask them. Let's go participate in that. Let's defer to them and show them that it is okay to not know everything, because the students are not doing that. Look for things that are authentic. Look for opportunities to authentically say, oh my gosh, we have an ethical decision to make. Let's pull in other people and get their viewpoints, because I'm not sure that I have the right answer. Welcoming students. Working in an operating room, when I would be welcomed by a surgeon or a PA or an NP or an anesthesiologist or anyone outside of my role who would embrace me and say, I'd love to teach you about this and why I'm doing it this way. I improved so much in my own role. Find a chance. If you don't know who that student is in the room, ask them about their life, ask them about their education, why they chose this job, tell them what you know about their job, anything you can do to engage with them, and it will absolutely impart the value of that team. Be flexible, because we need flexibility, especially in this, because students are doing so much at different levels, and there's competing accreditation standards and teaching styles and learning styles. So if you could be flexible in what you do and when you do it, that is immensely helpful to the students. And even if it's a short period of time, we will find a way. And the last is, don't do it alone, because Cypher exists to help you with interprofessional education. Like I said, we collect a lot of data. So every time a student goes to an activity, they have to turn in a survey, they have to evaluate it, what they learned, how they worked with it. And we collect a lot of that. We're working on not so much student report, but we're looking at doing more on students demonstrating collaborative skills. So we have some true outcome data. And we're looking at a lot of different innovative ways to teach this very particular skill. I believe very strongly that this is mission relevant to Creighton University. I believe it embodies our values and our Jesuit values and how we want students to practice in the real world. So it's an easy way to really communicate to your students how you think they should practice. All right, like I said, we can help. So that's my email address, and then there's Cypher's email address, cypher@creighton.edu. So two very easy ways to get a hold of us. And I love meeting new people, especially across campuses, professions outside my own. So I would love to collaborate with you on any way possible. So if there's any questions, I'd love to know them. And I do have references. So, and I've been completely ignoring the chat. Hopefully that's.
No, I think we're good. I've been looking in the chat. I do have one question that was asked directly to me or sent directly to me in the chat, and they would like you to address the fact that students of any health profession have got so much to learn. They really, really like getting out into the interprofessional situations and teams, but how do we carve out that kind of time for them to be getting into these teams and learning something from another program?
That is probably the number one challenge I do every single day, is finding the time for students to work together. Like I said, we're creative. We're creative a lot. One way we're creative is if you find natural times where there's overlap. For instance, I'm working a clinical shift with nursing students on the floor, and I noticed there are PA students at the same time. Is there a way where we could swap students out for even a short period of time, 2 hours? That would be incredibly impactful. PAs working alongside the nursing students, nursing's working alongside the PA. And it is not their entire clinical day. It is a small piece. Your program also has to be willing to consider that you can have mentors outside of your profession, and different accreditation standards just say different things, but there are ways for oversight that is not that, maybe that person, but they're a substitute learner. In other ways, we use telehealth kind of as a way. So we connect students from different time zones and different areas. I actually made a really wonderful connection with a nursing school in Australia, and they only have nursing, but they have 4,000 students at a time. They're like, we can't do interprofessional things. And I'm like, maybe there's a way I could negate the 13-hour time difference to have you zoom in with different, but creativity, honestly. Maybe it doesn't mean setting aside one day a month for interprofessional learning, but maybe we could. If I could get deans to agree to that, that this one day a month will be for interprofessional learning, that would be fantastic. But it needs to come from the faculty, and the faculty have to say, sure, that's possible. I'm trying to embed things already. Another way we're doing it is simulation. So in Warner here, when we're in the same simulation building, we're noticing there's times where students are doing simulations at the same time. Is there a way to cross do some of that and pull them over? Again, maybe even short, or use Zoom or another system to bring them into a debriefing. Maybe they're viewing the scenario and contributing in the discussion. That would be wonderful as well. Looking at different sites and thinking, is there a way I can use this interprofessionally? I can get interprofessional credit at the same time I get credit for something else. It's double dipping a lot. I can tell you right now we're working on an interprofessional ethics course, because I still feel strongly that my ethics as a nurse are not different than yours as a dentist. Like, we're still operating under basic principles, and the scenarios that our patients present with would value the discussion from multiple viewpoints of caregivers. And it's going to be a logistics challenge. It is a logistics challenge, but we're looking at different flexible ways. Even if, like I said, you can't commit to a huge amount of time, are there smaller chunks where that would build and build and build into something meaningful? Hopefully that answers your question.
Thank you. I think those are some great ideas for carving out some time. And I think you did answer their question. I do not see any other questions in the chat, but I do want to thank you, Dr. Jessen, for all the great ideas, speaking to so many of the different challenges, for sure, with collaborating, but also the benefits of working across health professions. Any questions from the audience? Anybody want to unmute themselves? And Jane, I can see you're trying. Have you got a question?
Yeah, I just, not really a question. I just wanted to say this was really timely as I get ready to go to the Dominican Republic for the summer. It's my favorite interprofessional activity of all. So this just really helps get my mind back in focus to get there and work with all the medical, nursing, pharmacy, and dental students. So thank you, Jenny.
Absolutely. It's good to see you, Jane. I find it a joy. It's one of my favorite things, is to take a student I can't professionally train, but tell them about what I do and learn about what they're going to do, and maybe impact how they work with that professional in the future, because it's a formative time for them.
Yes.
And you know what? We're not in the business. We can't turn away healthcare students. We need all of them. We need all of the healthcare providers to be working at the top of their game and willing to collaborate. So all students are our students in that sense, and how they impact patient care. So have a great trip.
Thank you.
And thank you for the shout out to Dr. Tina Younger. She is such a team player. Oh my goodness.
She's a joy.
The scheduling that she has done to get all of our different health sciences together in the same room, in the same place, because that can be overwhelming for a patient, right? You
Mm.
have five different students coming in at the same time, and you just can't throw more health professions into a room. You've really got to think about it strategically, and give all the students a chance to see different kinds of scenarios. So the logistics are very challenging. But Tina's been able to do it, and it sounds like Jenny, you've got some great ideas around that.
Mhm.
Okay, we do have a question. Do you have a mentoring program for students?
Do you mean student to student mentoring, I think, or faculty to student? We do have an honors program that we have faculty to student mentoring for students who want a little bit more of intensive interprofessional education experience. So the regular course is IPE 001 Passport. We have an honors version of that, and we have 3 students in it currently. Those students do a few more activities. They do some facilitation of interprofessional activities. They do a project around interprofessional learning, and they're mentored by faculty. So they have a direct one-on-one person that they check in with, and we talk about different roles. But I love the idea of a student to student one. Maybe that's what you mean. The students would love that. In all of my data, they want to work with each other. They absolutely want to learn more from each other, and they want to be involved with each other more. So Dr. Lady P, maybe you'd want to do that with me.
Thanks for that. I was just asking because I went to a conference. I currently work at UNMC in the College of Medicine with year 1 medical students, but I learned of like a mentoring program that they had, and they have like this database that mentors and mentees can sign up for. And also in some colleges, they're trying to implement mentoring programs so they can have that, interprofessional collaboration and then success among their students, just to have that extra, um, help and support along the way. But I am involved in IPE as well, where I am too. So thanks for the information.
Yeah,
Just wanted to know
Devin
all
Nickel.
the resources available.
Yeah. Devin Nickel is in charge of the program there, and he's wonderful. I work with him all the time. I'll have to ask him about that. The other thing that gives me a great opportunity to say is UNMC and Creighton are co-hosting an international conference for IPE here in Omaha at the Hilton next year, May 27 through 31. International conference here locally where we're highlighting Omaha, and it is going to be fantastic. It's a big collaboration between the Americans and the Canadian interprofessional groups. And if you've not done anything interprofessional, oh my gosh, these are the nicest people you will ever work with. They absolutely will have you join their team. They will absolutely reach out to you and collaborate in the future. It is just a nice community of people. So if you've got an abstract ready, it's going to come out this fall, and look for some more communication.
Wonderful. That is a great opportunity for people to get together. And Dr. Davis, you do bring up a really great idea of this opportunity for students to take on another connection with a different profession. Sometimes we think about, okay, physician students are paired up with mentors that are physicians, and we just focus in that way, or a new nursing student connected with a mentor that is already a nurse. And we can think about that in different ways, right? Those kind of mentoring opportunities would be really awesome. Any other questions? Well, thank you so much, everybody, for attending. And thank you so much, Dr. Jessen, for all the great knowledge and time that you shared with us.
Well, I appreciate you, Jessica. Thanks for being here, guys.